All right, good evening, guys, and thanks for joining me. I'm Andy. I am the clinical lead at ReadyCare, the chief nerd, as my wife calls me. So, what we'll be talking about today is we'll be looking at a couple of different things. So, I want to do a quick rundown on foods to choose, foods to avoid. It's good for new people. It's also good for the longer standing members because you can just do a little refresh and might give you a couple of ideas. And then I'm going to look at a couple of things that have popped up this week. I must have had 10 people start over the last week or two who also have sleep apnea and fatty liver. So I just want to talk about how the common underlying mechanism that causes type 2 diabetes, high blood pressure, fatty liver, sleep apnea, high cholesterol levels, all that sort of stuff, so that you're all kind of clued in and you know that. Before we start, can you, if you're not already subscribed, please do. It means a lot to us just to be able to bump the numbers up a little bit. And this thing always works back to front. If you're ever looking at people on YouTube channels and they go like this, subscribe over here, it's because the camera does it back to front. So when I point over here, it's on the other side. The subscribe button should be here and the bell notification should be here. If you can click both of those, you'll get a notification when we're going live. And I think an hour before we go live as well. Okay. Welcome to, and I won't use any surnames, Heather, Sean, Mary, Marguerite, who else? There's been a good few more. Gavin, Frank, and who am I missing out? Morgan. Welcome to you guys. Delighted to have you on board. I would have done your first consult and looking forward to getting your diabetes in remission and loads of other stuff fixed. Okay, so first of all, we'll take a look at what will we do first? Let's just take a look at this. So let's look at the broad kind of stroke approaches with food. So these are the ones that we want to avoid, obviously, guys. These sort of ones like, you know, your cornflakes, your oats, your shredded wheats, fruit and fiber, all that sort of stuff. It's bizarre that we were told for so long that porridge is so good for your blood sugar levels, yet when you check your blood sugar levels after eating porridge, they're generally speaking way higher than if you check them after eggs and avocado. So the slightest little bit of research on your own, you'll figure that out. So again, we want to move away from processed refined carbohydrates. As a general rule, when you're diabetic, carbs are not your friend. We want to avoid them. Okay, if we look at the other foods that actually convert to high levels of sugar in the blood, we've got foods like basmati rice. And by the way, that's any rice. I just use basmati as an example. That's about 10 spoons of sugar in your blood. And this is not my work, by the way. This is work of Dr. David Unwin, one of the clever doctors out there, who did a publication back in 2018 showing that in order to get your blood sugar levels as high as they are after a bowl of rice, you'd have to eat 10 or 11 spoons of sugar. After 2 potatoes, you'd have to eat 9 spoons of sugar. After chips, almost 8 spoons of sugar in your mouth, and so on. So these foods are not good for you. Bananas, 6 spoons of sugar. Wholemeal bread, and we all say wholemeal bread is so good for you, and you'll notice there it's a small slice. A normal slice is about 4.5. So you have your healthy wholemeal sandwich that has chicken and low-fat mayonnaise in it. You've got roughly 10 spoons of sugar floating around in your blood for 2.5, 3 hours afterwards. So when we look at this, we can think, well, it's no wonder we thought diabetes couldn't be reversed. It's no wonder our doctors still, for some reason, say, I don't think it can be reversed. Because if you're eating those foods and taking medications, it can't be reversed. So these are the foods that we want to avoid. Bread, rice, pasta, breakfast cereals. And actually these ones here, the breads and rice and pasta, whether they are brown or white makes little or no difference. So don't be fooled by the whole grain is so healthy and it's so good for you and it's lower in calories and it's full of fiber. It's not. Some of those statements are true, but it's also full of something that converts to sugar, and that's dietary carbohydrate. So again, if you're diabetic, consider yourself allergic to carbohydrate. So breakfast cereals, fizzy drinks, and by the way, the only thing that you could argue would be worse than fizzy drinks are fruit juices. So things like orange juice, apple juice. I picked up trying to remember where I was now. I was in Lidl yesterday with my family. I have a 4-year-old daughter and a 6-year-old son. And when they weren't running around trying to trash the place, I picked up a bottle of, what was it called? Like, I don't know, blue acacia power mix, something that was branded as extremely healthy. Like a big, large bottle. Look out for them in Lidl, actually, about that size of fruit juice. When I read the back of it, it had 82 grams of carbohydrates, 78 grams of which came from sugar, which means that there was 21 spoons of sugar in the bottle. And then, of course, it said a serving size was 150 mils, was this much. As if anyone drinks a sup and puts it away then till next week. It's such a nonsense, just clever marketing. So when you see fruit juices, just think straight shot to your liver to make your fatty liver worse and will not allow you to reverse your diabetes if you have them. Okay, so fizzy drinks, fruit juices, cakes and pastries and scones are included in that. They're more or less the same thing. So again, the beigey kind of carbohydrate, bready, grainy type foods are a disaster if you're diabetic. Your body converts all dietary carbohydrate into sugar in the blood. Remember that. Starchy vegetables, so things like potatoes and sweet potatoes. And sometimes people will say to me, but they're natural, so they must be good. And I'm like, look, you can naturally make heroin as well. It doesn't mean from poppy flowers. It doesn't mean everything natural isn't necessarily healthy for you. So starchy vegetables grow below the ground and they absorb starch, and that starch converts to sugar in the blood because it's a carbohydrate. So we want to be careful with those. And then high sugar fruits. And like I always say to people, you couldn't make it up. The ones that are taste the nicest are going to spike your blood sugar levels the most. And that's not a coincidence. We've evolved as humans to seek out fast energy sources for when we're starving. So bananas, grapes, tropical fruits all taste much nicer because they're higher in sugar and carbohydrate. So what do we eat more of? This is what we eat much more of. Meats, fish, seafood, cheese, green vegetables. I mean, meat and veg is always a really good choice, whether that is chicken and mixed veg to go into a stir fry, or whether it's ribeye steak with mushrooms and onions, cauliflower and butter. Those two meals would be perfect for your blood sugar levels. Fish and seafood. So again, if you're having fish, try to have vegetables with it that are not below ground root vegetables like potatoes and sweet potatoes. Instead, aim for all the other ones, all the above ground vegetables. Mushrooms, onions, asparagus, broccoli, kale, cauliflower, all of the other ones. If you're having cheese, have full fat cheese. The only problem now, if we look back at this slide, is that you've nothing to put it on because we've got the breads and crackers gone. You can make what are known as keto seed crackers. You'll find that it's a Diet Doctor recipe. Actually, I must hijack it and make my own version of it, but it's and put it up on the program for you guys. But it's Diet Doctor, DIET Doctor, Diet Doctor. And if you look up Diet Doctor keto seed crackers, there's a really good recipe for them that you can put your cheese and your butter on and so on. Eggs, and eggs, contrary to popular belief, will not give you high cholesterol. They do contain cholesterol, but your body doesn't just eat cholesterol and go, whoops, I better clog up all my arteries. That's not how it works. In fact, your liver makes about 80% of the cholesterol that's in your bloodstream anyway. So your body has a fantastic way of down-regulating the amount of cholesterol it makes. And by the way, cholesterol builds up within your arteries, not because you eat cholesterol, but because you've got damage to your intra-arterial wall. So basically where you have reactive oxygen species and what's known as a lot of systemic inflammation, cholesterol comes along and tries to do its job and help. So it's not that I should eat less cholesterol because I've got high cholesterol. You should eat less of the stuff that causes inflammation, and then the cholesterol won't build up. And that inflammation is caused by, you guessed it, sugar, processed carbohydrate, industrial seed oils, processed food, which in a nutshell kind of goes a far way to explaining why remote tribes around the world who eat colossal amounts of cholesterol and saturated fat but no processed food never get heart disease. Okay, so if we take a look at these ideas for your breakfast and lunch, this should get you started, and then we'll talk about the sleep apnea and the other bits and pieces. By the way, if you are a regular to the channel, if you're a regular member who's been with us for the last few months or someone who's brand new, please say hi. The one thing, if you just pop it in the comments, one thing that really helps motivate other patients is seeing somebody saying, I started the program 6 weeks ago, my blood sugars are way better. My doctor says I'm on my way to reversing diabetes, or I've come off my medication, or my blood pressure is down. Since I started the program, XYZ has happened. So I'd really appreciate, and just say hello. If you're one of my regulars, just say hello, because it's really nice. These sessions are for you guys. I want you guys to use this as your opportunity to ask someone with a lot of clinical experience in studies around diabetes and what you should eat and what you should avoid. Say hi, leave a comment, and make a little bit of sound. Okay, so eggs are the perfect food you can eat for your breakfast. Granola is really good as well, but not the shop bought granola. Fair play, Catherine. Catherine is listening. Thanks, Catherine, and hello back to you. So if you look at the granola recipe on the online program, hey Heather, how are you? Good to see you tuning in. Heather saying hello to everyone. The granola recipe I'm talking about here is not it's not the kind of standard commercially available shop bought granola. So the one that we have on our Control DTX platform, that's the one that you will have got an email for that says verify your email, and then you go onto the platform. You can see loads of other recipes. That's really good. Coffee with cream is good as well. It doesn't sound like it would fill you until you start realizing that your appetite dulls down a lot when you're on a low carb diet. Full fat dairy, so things like full fat Greek yogurt or cream with berries like raspberries, strawberries, blackberries, they would be great. Hey Beverly, hi, hope everyone is okay. And hey Nikki, how's things? Enjoying mixed salad, fair play on the ball, Nikki. That's good. Somebody wrote into one of my YouTubes before. I was presenting on the science of motivation or something along those lines, how to stay on track. And she wrote in saying, I'm eating a mince pie at the moment. And this was like November. She was eating mince pies, eating a packet of mince pies. If you're doing that, just don't tell me. Okay, lunch ideas, salads like chicken, bacon, avocado salad, any of those kind of mixed salads like you're having at the moment, Nikki. Meat and vegetables are great as well. Ideally avoiding potatoes and sweet potatoes because that'll help control the blood sugar levels. Creamy soup, seafood chowders once they don't have too much potato. Lettuce wrap burgers, they're all great. And for dinners, just kind of keep it simple. So that meat and veg type thing, you'll see people having cauli curry, so having a normal butter chicken masala type curry or any other curry for that matter actually, with cauliflower rice. The reason you'll start seeing everyone eating cauliflower rice is because it doesn't spike your blood sugar levels. Therefore, it doesn't contribute to fatty liver, sleep apnea, type 2 diabetes, and it will help you lose weight. It'll help you reverse all those conditions. Omelets are good if you eat eggs. They're super. Stir fries without rice or noodles would be great. So mixed veg, stir fry kind of a thing. Nuts, with the exception of the nicest tasting ones, which are peanuts and cashews, and dark chocolate. Now, with dark chocolate, ideally you want to go above 80% dark chocolate if you can stomach that. It's a kind of an acquired taste and takes a while to build up to it. Start off at 75, 78 and then go up to kind of 80 and 85% dark chocolate. Berries and cream and cheese, they're all your better options. This one is hugely important, how to read food labels. If you're diabetic, the number one thing to look for, over and above everything else, and try to drown out all is carbohydrates. Try to drown out all the other noise that says, but this is not organic and it's got glyphosates on it, and this has got rapeseed oil in it, and this one is higher in calories and lower in calories. Type 2 diabetes is carbohydrate allergy. Sleep apnea is a manifestation of carbohydrate allergy, as is fatty liver, as are loads of different conditions like polycystic ovarian syndrome. They're all different manifestations of hyperglycemia, which is a fancy way of saying high blood sugar levels that lead to high insulin. I'll show you the mechanisms at play in a second, but it's unbelievably clear. So if you look at this food label here, for example, you'll see total carbohydrate, 36 grams, 36, of which sugars, 2.5. Now, if you notice actually what they've done here, which is fair, this is from cornflakes, it says of which sugars, and in brackets, sucrose. Sucrose is table sugar. So it's saying, it's actually getting into detail and being specific. It's saying, look, it all sugars, but actually we're just talking about table sugar, of which is table sugar. All of that turns to sugar in your blood, all 36 grams. And if you divide the 36 by 6, you'll get 9-ish. That's about 9 spoons of sugar in your blood. So as a general rule, if you did want to know, if you wanted to give yourself a fright, if you looked at a tub of ice cream and it said 180 grams of carbohydrates, let's even it off. Let's say half a tub is 100 grams of carbs, and that wouldn't be too far off the mark. If you wanted to know how many spoons of sugar will end up in my blood after that, divide that carbohydrate number, not the sugar number, the carb number, by 4. So 100 grams of carbohydrate, which is around half, I think, maybe 3/4 of a tub of Ben & Jerry's, divided by 4 is 25 spoons of sugar in your blood if you eat that. So that's a good way of looking at it. But the better way to do it actually is if you just remember the two numbers. Less than 100 grams of carbohydrate is low carb, and less than 50 or 50 grams of carbs is considered keto, ketogenic, or very low carbohydrate. Both will help you reverse your diabetes. A ketogenic diet will do it quicker. So that's really important that you remember. And they are all the basics when it comes to type 2 diabetes. Comment from Hugh. Hi, Andrew. I like a coffee. How are you, Hugh? But I cannot drink it black. It's a pity that most coffee shops don't have cream. An exception is Costa. Yes, that's a good point. I'd say a happy medium there, Hugh, if you're trying to avoid milk, is just have an Americano and have some milk in it as opposed to a cappuccino. I rarely see my patients having problems with an Americano if they put some milk into it. But I do see problems with cappuccinos and lattes and stuff like that. It happens to me all the time. Patients are saying, I'm not eating any carbs, and then I'll go through their day and everything they eat, and I'll say, you're not drinking any coffee or anything like that. They'll go, I'd have 2 or 3 cappuccinos, and every time they have the cappuccino, the blood spike really high because of the naturally occurring sugars in milk called lactose. So you can't drink it black. Most coffee shops don't have cream. Yeah, I'm sad. I'll go to Costa and I'll like bring a little thing, or any coffee shop, and I'll bring a thing of cream with me. It's a pain to have to do it, but yeah, they don't have cream, and most of them. I think you're right. I think Costa does sometimes. I've seen that in the one in my local one here in Cork and Douglas. But I think the other ones that have cream, like they give you that stupid spray cream that is bursting full of sugar. Okay, let's look at this. So this is this is just something I want to point out, and I'm not doing this to show off, but these are awards that we've won: the Clinical Pharmacy Congress Awards in 2021 with the NHS, and the Paul Dudley White International Scholar Award that myself and my colleagues won for basically being big nerds when it comes to diabetes. So the reason I'm showing you this is when we put people on the exact diet that we're talking about now, the exact diet that you guys are going on, these are the results we saw. We saw a 48% reversal of type 2 diabetes at the 8-week mark, which was only halfway through. We saw about a stone of weight loss. We also saw the triglyceride levels going way down, and we also saw blood pressure going way down as well. And the reason this is important is because what you're seeing across the top bar here is the resolution of insulin resistance. As insulin resistance goes away, all of these things happen. And insulin resistance, I better explain this concept. So insulin resistance is basically when you eat carbohydrate over a prolonged period of time and or you have a genetic predisposition for being insulin resistant. And by that I mean you have either type 2 diabetes, obesity, or high blood pressure in your family. You can be very sensitive to carbs. And every time you eat carbohydrate, so we spoke about how it boils down to sugar in the blood. And when it boils down to sugar in the blood, what happens is your pancreas is an internal organ that has to make a hormone called insulin to get your blood sugar levels down. Eventually it breaks, and we refer to that as insulin resistance. So basically, the body can't use the insulin that it's producing, and the insulin builds up and there's loads of insulin in the body, but you can't use it. The body becomes essentially resistant to the action of insulin. It's a very difficult thing to explain, but basically, if you can imagine, if you put white noise on in the background, white noise going, and that would drive you crazy for about 10 or 15 minutes, and then you kind of forget it's there, and then you kind of miss it if you turn it off. So that happens with insulin. So when your pancreas breaks, instead of making too little insulin, it's like the accelerator braking on a car, but going forward and sticking to the ground instead of going backwards. So it's revving and making loads and loads and loads of insulin, but your body says, there's so much insulin coming in here, floating around the body, I'm not going to use it anymore. Now, the high levels of insulin lead to, and by lead to I mean are the main cause of diabetes. Obviously, that's what diabetes is when the pancreas breaks. Obesity, because insulin is a fat storage hormone. Dyslipidemia, because within your cholesterol levels, high levels of insulin causes low HDL, which is good cholesterol, and high triglycerides, which are dangerous. And the triglycerides, by the way, are fats that go into your liver, and that's why it leads to fatty liver. High blood pressure, because high levels of insulin cause constriction of your blood vessels. Alzheimer's, because insulin resistance and high levels of insulin, when it goes to the brain, we call it Alzheimer's, which is why in the clinical literature they refer to Alzheimer's as type 3 diabetes and Parkinson's as type 4 diabetes. Sleep apnea is visceral fat storage in the back pad of the tongue and nothing else. So there's 2 different types of sleep apnea. There's a couple actually. One is called central sleep apnea, which is like a neurological disorder of the brain where you don't have any fat buildup in the tongue. OSA, obstructive sleep apnea, where you wake up at night, is if you scan somebody who has sleep apnea, every single time with OSA, they'll have a build-up of fat in the back pad of the tongue. And I'll show you the reason that happens now in a second. It's fascinating. PCOS, high levels of insulin go on to cause polycystic ovarian syndrome, so cysts on the ovaries. It's the world's leading cause of infertility in women of reproductive age, so women under the age of 40 or 45. NAFLD and NASH. NAFLD just stands for non-alcoholic fatty liver disease, and NASH stands for non-alcoholic steatohepatitis, which is basically when non-alcoholic fatty liver disease gets really bad and you get cirrhosis of your liver. Both of these, if it's not alcohol, are caused by carbohydrates. So let me show you why this happens, because this is fascinating. And before I do, actually, this is someone on the right who has a BMI of 35 but doesn't have sleep apnea. See the slight gap at the back there, right at the back of the throat? So when they relax, the tongue just flattens out, it doesn't go back. And on the left side of the picture here, you'll see somebody who's insulin resistant. So they have the fat buildup in the back pad of the tongue, much more so. They're both the same weight. In fact, the person on the left is actually slightly lighter. So the person on the left has insulin resistance, so that diabetic type physiology, and the person on the right doesn't. That's sleep apnea in a nutshell. Okay, so this is really interesting because it actually, to be honest with you, it breaks my heart when I talk to people and they say to me, why is it taking me this long for someone to explain this to me? So somebody to sit them down and go, you know, your fatty liver and your weight around your midsection and your sleep apnea and your high blood pressure and your high cholesterol, all of those are the same thing. They're all insulin resistance. So basically your blood sugar levels trend high, your pancreas breaks from making insulin, it continues to make loads and loads and loads and loads of insulin floating around the body, and that's what causes carbohydrate metabolism dysfunction. So it causes fat to be stored in the liver anytime you eat carbohydrates, fat to be stored in the heart, fat to be stored around the midsection, which is why when you have diabetes, you will almost always store the vast majority of your fat around the kind of spare tire area as opposed to your bum, shoulders and chest and so on. You'll get a fatty pancreas. Most people don't realize this until they scan it. It doesn't matter. It goes away after a number of weeks anyway. And tongue fat, which is what we call sleep apnea. So this is the reason why we tend to see all of these conditions together. It's basically dietary carbohydrate intolerance driving something called ectopic fat storage. And ectopic just means inside an internal organ. So this is both good and bad news. I would argue great news, because I love having a consultation with a patient and I'll say, actually, I'll explain this, and I'll say, actually, the vast majority of the things that you're suffering from at the moment, your blood pressure, your fatty liver, your sleep apnea, the weight gain, all of these things are different expressions of the same thing, which is bad news in the sense that you got all of these together and you were thinking, what the hell did I do wrong to get all of these going wrong? The good news is that if we reverse engineer this back and go up to this point here, if it's insulin resistance from carbohydrates and we eat little or no carbohydrate, all of these can go away, all of these. And it's not unusual for us to hear patients saying, I wear a CPAP, but for the first time in about 10 years, I didn't need to put my machine on. I just woke up, I fell asleep without it. And it, my breathing was much better. Actually, I have someone on, if you don't mind, I'd really appreciate this. There's someone on the call, and I don't want to say her name just in case you're not comfortable with it, who sent me a text a couple of weeks ago saying that something like you did a sleep study test and you had stopped breathing 22 times a night and now it was only once, or 22 times an hour and now it was only once an hour since you went on the program. Would you mind popping in a comment if you're comfortable? If you're not, there's no panic. We'll leave it anonymous if you're not comfortable. So that is why you end up with sleep apnea, fatty liver, weight around the midsection, high blood pressure in a nutshell. Okay, and this is the paper that came out just a couple of years ago. This is why a lot of sleep specialists don't know this, saying that actually the reduction in tongue fat is what improves your obstructive sleep apnea, not weight loss itself. So it's actually possible, and this is really fascinating. Well, I find it fascinating. It's really nerdy, but you can keep someone on the same amount of calories so that you control their weight. Keep them on whatever, 2,500 calories, whatever it takes to keep their weight the same. But by putting them on a low carb diet, by making up that 2,500 calories of low carbs, you can cause a reduction in tongue fat, and without any weight loss, you can get rid of sleep apnea, which is amazing, because the narrative has been, well, you have to lose loads of weight and then you might get rid of your sleep apnea. Not the case. Low carb diets are so effective for sleep apnea, fatty liver, and type 2 diabetes. Okay, these are just some of the studies, but look, what you'd expect to see. People on a low carb diet, which is in the intervention group, had significant changes from baseline in terms of their breathing patterns and things like that. This is interesting because there was a patient in our UK trial who lost 10 kgs, which is about 20 pounds, but he was still 310 pounds, which would fall into the morbidly obese category. But because we put him on low carb, if you look here now, you'll see he's seen a significant improvement in his sleep apnea, commented that he no longer wakes up at night, having previously woken up 6 to 8 times a night. So he's getting a full night's uninterrupted sleep, doesn't wake up at all, never stops breathing anymore. Not because he lost a lot of his body weight. He didn't actually lose that much. He was still 310 pounds, which if you work in old money is 21 stone. So still morbidly obese, but had massive improvements in his sleep apnea. Question from Nikki. What can you look for to see your own tongue has tongue fat? Not a whole lot, Nikki, really. The only way to do it would be to check on it. There's like scans and stuff you can do. So it would have to be kind of an MRI for tongue fat. But if you have sleep apnea, you have tongue fat. It's basically as simple as that. Heather, is the idea that we get into ketosis? Yeah, ultimately, Heather. I mean, it's not necessary to get to stay in ketosis all the time. So this is something that frustrates me a little bit around the narrative of ketosis. You'll see these YouTubers saying silly things like, oh, don't ever have a slice of bread, or, don't have a cappuccino or an apple because it'll knock you out of ketosis. It will knock you out of ketosis, and then you'll go right back into it. So ideally, you stay pretty strict for a couple of weeks. You start to notice your appetite's reducing, you're losing weight, you're feeling better, your energy levels are bottoming out. That's a sign that you're in ketosis. Now, there's been this unnecessary trend of, checking your blood ketones all the time. And by the way, don't bother. There's no need to do that. If you're eating little or no carbohydrates, then you're in nutritional ketosis. You are. If you're not flattened with energy and falling asleep all day, every day, you're in nutritional ketosis. Will milk or bread knock you out of ketosis? Yes, it will. But you will get back into ketosis again. So ideally, be pretty strict on your foods for the first couple of weeks, and then the odd bit here and there might knock you in and out of ketosis. But you don't need to be in ketosis all the time to reverse fatty liver, diabetes, those sort of things. Oh, Beverly, fair play. I wasn't sure if I should say her name. So Beverly, her sleep scan was showing that she stopped breathing 22 times an hour, and now it's an average of 1.5 times after going on a low-carb diet. Thanks for that, Beverly. Okay, so this is pretty shocking. If we look at the prevalence of non-alcoholic fatty liver disease, 40% of people have it. You don't know you have it until it's too late, until it causes trouble down the line. 60% of people who are overweight have it. 30% of overweight children have it. That's from a study in Germany last year. And 90% of people with type 2 have a fatty liver. So if there's a scientist in the area who said, it's smarter way of saying it, but he said 92% of diabetics have fatty liver and the other 8% haven't found out yet. All diabetics have fatty liver. It's what happens before you become diabetic is you get a fatty liver. And it can be a really, really risky thing to have for a long period of time, but you are in really good hands because your fatty liver will be dramatically improved and maybe reversed, usually reversed actually within about 8 to 10 weeks. So if we look at fatty liver, this is really interesting. If we look at the dietary drivers of fatty liver, it would be fair to assume that we should eat less fat, like eggs, butter, cream, and fatty meats. But actually, what does the damage are the other two. So dietary carbohydrate is responsible for 59% of the fat that goes to your liver. And fruit is responsible for 26%, more specifically fructose, in the form of fruit sugar. So they're the two things we should be cutting down on. And funnily enough, if you were to eat a higher fat diet like fatty meats and eggs and avocado and chia seeds and dark chocolate and all that sort of stuff, it would reverse, and it does reverse fatty liver. I've seen this a million times. So you would suspect, actually, you would say, I should better stay away from fats because they'll give me an even worse fatty liver. They don't. No different than eating a low carb, high fat diet doesn't make you gain fat. It does exactly the opposite. Okay, so this is something I wanted to look at here. When it comes to treating fatty liver, sleep apnea, type 2 diabetes, you want to look at the foods that spike your blood sugar levels the most. And the reason we want to do this is because the foods that spike your blood sugar levels also spike that hormone insulin. When you spike insulin, your body stores fat in the form of triglycerides. It converts the glucose from carbohydrates into triglycerides and shoves them into the fat cell. And if it can't get them into any more fat cells because you're insulin resistant, it starts shoving them into the tongue, into the liver, into the pancreas, and so on. If we reverse engineer that process, and we have the power to do that, if we eat less of the foods that spike our blood sugar levels and so our insulin levels, which are carbohydrates, bread, rice, pasta, cereals, granola bars, all of that, bread, all the good stuff. If we avoid that, and if we eat way more of the eggs, avocado, chia seed, dark chocolate, nuts, meats, all of the green vegetables, all the above ground vegetables, the fruits from the berry category, and so on, blood sugar levels come down, And within a couple of weeks, our liver says, well, I have no reason to have all this fat stored in the liver. Let's get rid of it because it's not in panic stations anymore. And it says, let's get it out of the tongue. Let's get it out of the pancreas. And it burns it all up. And also you start to burn body fat as well. So the idea is eat less of the processed carbohydrates, much more of the fat and protein, and everything gets better. And just one final thing. So this is a paper on fatty liver actually, which looked at the weight loss on a low carb diet versus the weight loss on a low fat diet. Now they had the same amount of calories, again going back to what we're talking about here with insulin resistance. The weight loss was roughly the same, it was about 5%. The low fat group were eating about 1,300 calories, and actually the low carb group were eating 1,500 calories. But the liver fat reduction, hepatic fat as it's called, hepatic triglycerides, was dramatically more on the low carb diet. So it's not about calories in, calories out. Human health is so much more complicated than that. It's about hormonal optimization. So if you can move away from the foods that spike your blood sugar levels, this is a connection here. Lower blood sugar levels, lower levels of insulin has a knock-on effect on reducing your blood pressure, optimizing your cholesterol levels, allowing your body to freely metabolize fat that's within the tongue, the pancreas, and the liver. So that's sleep apnea and fatty liver dramatically improved, if not gone. Your weight goes down, you feel better, polycystic ovarian syndrome symptoms go away. All of these conditions are underpinned by insulin resistance. Insulin is not your friend. We need it to survive, we need it to live, but we only need very small amounts of it. So let's not spike that. So you're on the right track if you have those conditions. If you have any questions, pop them in now. Any comments if you want to let people know how you're getting on. Congrats to 3 different people this week. Martin, Kieran, and I can't remember the last one, my apologies, who put their diabetes in remission and are off medication. That's the reason why I get up in the morning and do this job. Guys, have a good evening. Thank you so much for your time. Don't forget to subscribe if you want to see us doing this channel. Is just for you guys. It's just a members channel. So subscribe and you'll get a notification if you hit the bell notification or the bell icon underneath this video. Have a good evening. Hope you enjoy the sunshine over the next few days, and I will see you next week. Take care, everyone. Bye-bye.